Standing at the foot of the plinth, grasp the ankles and gently apply traction to the legs. Starting on your model's left leg, gently grasp the ankle and move up to the knee, and then continue up to the thigh. Grasp the ankle with your left hand, place your right hand under the knee and flex the knee vertically. No bouncing. Maintain the same grasp on the ankle, place your hand under the knee again and lift and pull the knee outwards or towards you while slowly applying rotation to the hip. And when you bring the leg back down again, make sure you support behind the knee to prevent the knee from locking. Maintaining this grasp on the ankle, place your hand under the knee again and gently lift and push the knee inward or away from you while applying rotation to the hip. Bring the leg back down again and move over to the right leg. Gently grasp the ankle, move up the knee, and then continue up to the thigh. Grasping the ankle with your right hand, place your left hand under the knee and flex the knee vertically. Bring the leg back down again and make sure that the knee doesn't lock. Maintaining grasp on the ankle, place your hand under the knee and lift and pull the knee outward towards you while slowly applying rotation to the hip. Maintaining your grasp on the ankle, place your hand under the knee and gently lift and push the knee inward or away from you while slowly maintaining rotation. Moving up to the right arm, grasp from the wrist to the elbow and continue up to the shoulder. Grasp the right wrist with both hands. Your direction should be 45 degrees to the body and apply traction while shaking out the arm. Return the hand to lie on the abdomen or most comfortable position for your model. Moving up to the left arm, grasp from the wrist to the elbow and continue up to the shoulder. Grasp the left wrist with both hands. Your direction should be 45-degree angle and apply traction while shaking out the arm. Return the hand to lie on the abdomen or most comfortable position for your model and move up to the head of your plinth. Sit and balance yourself on the stool, placing both feet firmly on the ground. Gently stretch the neck by placing your dominant hand under the neck and applying the stretch. Support your hand with your other hand. You may or may not feel a dural pulse. This is dependent on your model and the environment that influences your model. Relax and breathe evenly and deeply, breathing in through your nose and out through your mouth, keeping the tip of your tongue, the roof of your mouth, just behind your teeth. Next we go to the finger lift. We lift the head by placing your fingertips on the occiput and holding the head in this position. You should feel the bone of the skull while holding this part of the sequence. Keep breathing gently and relaxed. Pull the neck to the left, push the right shoulder down with your right hand, applying a gentle stretch to the neck and shoulder. Keep your hand under the head while you apply this technique, and then stimulate GB20, making sure that you don't apply too much force. Remember, appropriate pressure, appropriate duration, appropriate rhythm and gentleness. Watch your model's facial expression. Using 2 fingers, knead down the sternocleidomastoid and mastoid muscle gently, slowly, and only in one direction, down to stimulate GB21. GB21 is forbidden during pregnancy. Next, stimulate Sanjiao 15, which is located one sun directly behind GB21. Next, pull the head to the right and push the left shoulder down with your left hand, applying a gentle stretch to the neck and shoulder, and keep your hand under the head while you apply this technique. Stimulate GB20, making sure that you don't apply too much force or pressure. GB20 is an excellent point for headaches, for subduing what they call liver yang, brightening the eyes when the eyes lack vitality. It also benefits the ears, especially for tinnitus. Using 2 fingers, knead down the sternocleidomastoid muscle gently, slowly, and only in one direction, down to GB21. Stimulate GB21, taking care not to press too deeply. Watch for facial expression. This point is forbidden during pregnancy because it promotes delivery if baby is late. Next, stimulate Sanjiao 15. Next, we're going to start the facial rejuvenation sequence. We're going to stimulate Yin Tang, which is number 1 on your sequence, in between the eyebrows, on the midline of the body. An excellent point for calming the mind and promoting sleep. Next, we stimulate Bladder 2, number 2 on your sequence. It's found at the medial end of the eyebrow. Soothes the liver. It also stops pain and clears the head. Next, we're going to stimulate Yu Yao, an extra point found in the middle of the eyebrow. Take care not to press too hard on this point. It brightens the eyes and relieves pain in the local area, so it would be very good for frontal headaches. Stimulate Sanjiao 23, which is found in the depression at the lateral end of the eyebrows. Moving on to Taiyang on the temples, use your index fingers bilaterally, gently forward circular stimulation. This point relieves headaches. Moving up to stimulate Stomach 8, which is number 6 on your sequence, using your index fingers bilaterally. Stomach 8 clears heat and relieves dizziness. Next, we're going to stimulate GB15, found midway between Do24 and Stomach 8. It regulates the emotions, regulates the mind. Next, we're going to stimulate Do24, number 8 in your sequence, found on the midline, half its sun within the hairline, the anterior hairline. Calms the mind. Next, we stimulate Yizong, number 9 on your sequence. One sun directly above Yin Tang, relieves dizziness, benefits the eyes, regulates the emotions. Next, we're going to stimulate GB14. It's on the forehead, one sun above Yu Yao, or the midpoint of the eyebrow. It subdues rising yang. Next, we're going to stimulate Stomach 2, very gently, found in the depression at the infraorbital foramen just under the eye. Next, we're going to stimulate large intestine 20, found in the nasolabial sulcus or groove. Excellent point for sinuses, catarrh, allergic rhinitis. Next, we're going to stimulate Bi-Tong, an extra point, number 13 on your sequence. It loosens stagnation, benefits our sense of smell, and benefits the nose. Next we're going to move to the left hand and stimulate large intestine 4, found midway between the junction of the first and second metacarpal bones and the margin of the web. This point is forbidden during pregnancy. Spread the metacarpals and rotate the hand to knead the palm, locking both our little fingers at the junction of our model's thumb and little finger. Knead the palm with your knuckles, or you may also use your thumb pads. Moving on to the fingers, slowly, gently, maintaining as much skin contact as possible, press the top and bottom of each finger and the sides of each finger. About 4 presses, and then rotate the finger and flick the finger, which breaks any stagnation in the finger joints, and repeat on the remaining 4 fingers. Holding the wrist, lift the arm and thumb knead up the anterior arm. Remember, no scraping, only moving the flesh under the skin, slowly and gently. Continue to knead up towards the transverse cubital crease. Turn the hand, maintain your hold on the wrist, and proceed to knead up the posterior aspect of the arm with your thumb, moving flesh only under the skin, up towards the elbow. Here we're going to grasp large intestine 11 and heart 3 between your thumb and your index finger or middle finger. Rotate the elbow clockwise and then anti-clockwise. Place the arm on the plinth, grasp the wrist and knead up from the elbow to the shoulder. While still holding the wrist, step up and abduct the arm to locate large intestine 15 and Sanjiao 14. Place your thumb on large intestine 15 and your index finger on Sanjiao 14. Bring the arm to a 45-degree angle to the body and apply traction while shaking out the arm, and maintain stimulating appropriate pressure. Relax the traction and place the left arm on the plinth or on the abdomen, and move over to the right arm, where we're going to stimulate large intestine 4. Remember, large intestine 4 is forbidden during pregnancy. It's a clearing point. Spread the metacarpals and rotate the hand to knead the palm, locking both our little fingers at the junctions of our model's thumb and little finger. Knead the palm with your knuckles, or you may also use your thumb pads. Next we're going to move on to the fingers, repeating as we did on the previous hand. Slowly, gently press the anterior and posterior of each finger, the top and bottom of each finger, and then the sides of the fingers. Then rotate the knuckle and then flick the finger, which breaks any stagnation on the finger joints, and move on to the remaining fingers. Holding the wrist, we're going to thumb knead up the anterior arm without scraping, only moving the flesh under the skin. And continue to knead up with your thumb up as far as the transverse cubital crease. And then we turn the arm and we hold the wrist. Proceed to knead with the pad of your thumb up the posterior aspect of the forearm. Continue to knead up as far as the cubital crease, where we find large intestine 11 and heart 3. Gently grasp these 2 points between your thumb and your index finger or your middle finger. Rotate the elbow clockwise and then anti-clockwise. Place the arm on the plinth, grasp the wrist and knead up from the elbow to the shoulder. While still holding the wrist, step up and abduct the arm to locate large intestine 15 and Sanjiao 14. Place your thumb on large intestine 15, your index finger on Sanjiao 14. Bring the arm to a 45-degree angle to the body and apply traction while shaking out the arm and maintain stimulating appropriate pressure. Relax the traction and place the right arm back on the plinth and move down to the bottom of the plinth to the legs. Grasp the ankles and apply light traction to the legs. Using your thumb, press bilaterally kidney 1. It's on the sole of the foot. Kidney 1 tonifies the kidneys and yin. It also clears heat. Next we move on to spleen 3. Strengthens the spleen, resolves damp, strengthens the spine. Next we move on to spleen 4. Tonifies the spleen and stomach, pacifies the stomach and regulates menstruation. Next we're going to move on to liver 3 on the left foot. Stimulating this point, we could be subduing liver yang and promoting the smooth flow of liver qi, also nourishing liver blood and liver yin. And next we move on to the right foot and stimulate liver 3. Liver 3 on both feet also regulates menstruation, calms the mind and calms spasm. Next we're going to stimulate kidney 6 bilaterally. Kidney 6 nourishes the kidneys, nourishes yin, benefits the eyes, benefits the throat, opens the chest. Next we're going to start on the left foot and we're going to stimulate kidney 3 and bladder 60 together in a pinch and rotate. Remember, bladder 60 is contraindicated in pregnancy. And next we're going to move over onto the right leg and stimulate kidney 3 and bladder 60. Next we move on to spleen 6. We're going to stimulate that bilaterally, 3 sun above the tip of the median malleolus. Spleen 6 resolves damp, benefits the spleen and stomach, promotes the smooth flow of liver qi, tonifies the kidneys. And then we're going to move up to stimulate spleen 9. Spleen 9 benefits the lower jiao, benefits urination, especially if the urine is cloudy. Next we're going to stimulate spleen 10. Spleen 10 is shui high. If you can't reach from the bottom of the plinth, step to the left leg of your model and stimulate this point. Cools the blood, removes stasis of blood, regulates menstruation, tonifies blood. On the left leg of your model, you're going to stimulate GB34. Promotes the smooth flow of liver qi, resolves damp heat, relaxes the sinews, and then stimulate stomach 36. Stomach 36 benefits spleen and stomach, tonifies qi and blood, dispels cold, strengthens the body, brightens the eyes. And then we're going to dredge the spleen and stomach channel down the stomach channel, up the spleen channel. We're going to do that 3 times. And then we're going to lift the leg, bend the knee, sit on the plinth to prevent the knee from sliding, and dredge the gastrocnemius bladder meridian. Clasp your hands together behind the gastrocnemius and pluck the length of the gastrocnemius. And then vibrate the belly of the gastrocnemius. Replace the leg on the plinth and move over to the right leg of your model, where you're going to stimulate gallbladder 34. Promotes the smooth flow of liver qi, resolves damp heat. And then after that we're going to stimulate stomach 36. Very powerful tonifying point in the body. And then after that we're going to dredge the spleen and stomach channels down the stomach channel, up the spleen channel. These are the directions of these meridians 3 times. And then we lift the leg, bend the knee, sit on the plinth to prevent the foot from sliding, dredge the gastrocnemius or bladder meridian. Clasp your hands together behind the gastrocnemius and pluck the length of the gastrocnemius. Vibrate the belly of the gastrocnemius. And move up to the abdomen on the same side of your model. Gently rub the abdomen just to warm it up. Wide circular movements. And then with the heel of the palm in a clockwise direction, gently rub the abdomen along the large intestine, up the ascending colon, across the transverse colon, and down the descending colon to the sigmoid colon. Next we're going to vibrate with the palm of our hands over Ren 8, found in the umbilicus. Next we're going to locate Ren 4. Ren 4 is 3 sun inferior to the umbilicus, and we're going to do a finger vibration. Next we're going to locate Ren 6, 1.5 sun inferior to the umbilicus, and another finger vibration to stimulate this powerful point, which tonifies qi and yang, regulates qi, nourishes original qi and resolves dampness. Next we're going to vibrate stomach 25. 2 sun lateral to the center of the umbilicus. Next we're going to vibrate Ren 12. 4 sun above the umbilicus tonifies the spleen and stomach. Next we want to stimulate stomach 21, which is 4 sun above the umbilicus, 2 sun lateral to Ren 12. And then we're going to vibrate with the palm of our hand over Ren 8, just to finish off the abdomen sequence.